a 1 month old can be diagnosed with cancer. And to me, that is painful. And as you've said, children are very innocent. But what are some of the causes? What are the underlying factors that contribute to childhood cancer, and how can they be prevented?
Well, Brian, the reason why I mentioned earlier on that the strategies that we use in adults is different from children is cancer causation is a long process, what medically we call carcinogenesis. And for children, since they are young and they are, can be diagnosed as early as a day or a month into their life in this world, we do not have them being exposed to the risk factors other than one, which is hereditary. This means genetic predisposition. So when these children, and my teacher taught me not to call them kids, it's disrespectful. When
Americans like saying kids.
No, but it is disrespectful. These children, when they are born, they have not been exposed to what we call trigger factors. Of course, for everyone to be diagnosed with cancer, there has to be an imbalance between their genetic makeup and their immunity. So if your immunity is weak and you have genetic, let me say, instabilities, then you just need a trigger factor to initiate the process.
What are some of the prevention measures? Because I know you're talking about some hereditary.
Well, our government currently shifting into, promotion and prevention, generally in approaching health, moving away from curative, which is very costly. But in children, it is a bit different. We do not have so much focus, especially in cancer, on prevention. We are actually focusing on quality treatment because, as I've rightfully said, whatever we would always want to prevent is on the risk factors, but then there are not much risk factors. So what we would do is to encourage parents when they are carrying, these lovely babies in utero, to avoid potential risk factors, alcohol, tobacco use, which are known to be risk factors for adults, exposure to chemicals. But from evidence, this has not been the main reason why children get diagnosed with cancer. It is genetic instabilities that, and their immune, which is compromised. So if you have a child, for instance, who has HIV, we have what we call prevention of mother-to-child transmission of HIV, because HIV affects the immunity. But there are many other causes of immune compromises other than this. So it's important that the approach, and we would want to educate and inform the public on importance of, quality diagnosis and quality treatment for childhood cancers. That has to be very, very clear. We are not focusing
specified.
so much. It is specified. In our country, the leading types of cancers in children are different from adults. We are talking about leukemias. These are blood cancers. So we are talking about lymphomas. These are cancers that affect lymph nodes, those glands that we have them in our armpits, that we have them in our groins. Remember when we were growing up, if you have a wound in the leg, then you find a swelling by your groin. Those are called lymph nodes, and they are important in providing immunity for us. But now when you get cancer, they overmultiply as a way of responding to a challenge that they are facing, and they swell. That is lymphomas. We also have kidney cancers in children. If you look at what our focus is really, we also have brain tumors among the children, and head and neck cancers called nasopharyngeal carcinomas. And there are many other cancers that affect children as well. So our focus is how do we then diagnose early by educating parents, educating healthcare providers, even our medical team. They need to know, how do we suspect? High index of suspicion in children matters more than teaching people about prevention. Because for children, if you diagnose early, you can actually simply treat them and they get cured. And these are the approaches which the West are using. A mother should know when they are, showering their little baby, what telltale signs can they be doing? For example, if you want to diagnose cancer of the kidney. We call them nephroblastomas. We are asking mothers, when you are cleaning, showering your babies, be touching their tummy. You can pick something which is bumpy and you can report early.
Is proper care, up close care, because sometimes we have parents who are very busy. As soon as they start taking care of the children, maybe the first 3 months, the fourth month, amerudi kazini, then it becomes hard for them to actually just take care of the baby.
Parents, you cannot afford not to take control and charge of your children while they are growing up. And we have to do this jointly. Give you another example. In school, you see a kid who, while the others are playing, looks lazy, cannot run. When you ask them to walk, they breathe very fast. And also, parents at home, when you see your child is not very active, sometimes it could just be this child is weak because, they have low blood levels. And these are among the first telltale signs for leukemias.
How best we can have the conversation on cancer, especially childhood cancer, and of course reducing the survival gap. But of course there is policy, Dr. Elias, that at National Cancer Institute of Kenya, you are on the front line to make sure that the policies that govern such spaces are able to aid individuals in prevention matters when it comes to cancer. Talk to us a little bit about that.
Well, thank you, Brian. It's important for me to mention this. Before I mention about policy, get your child, suspect the symptoms, and get care from a facility, from qualified healthcare workers. When you see the doctor, the doctors are going to interrogate further, and the doctors will ask for additional investigations, whether it's laboratory or diagnostics through imaging, scans, and further give a care plan once a diagnosis has been made. In our country, we have very few centers that treat children. And I want to inform our listeners and those who are viewing that we have Kenyatta National Hospital, we have Moi Teaching and Referral Hospital. Those are our major hospital in public that provide childhood cancer care comprehensively. We have other centers that we are trying to build now. Our approach in Kenya is regional centers for cancer treatment for children, not every other county. We cannot afford. The numbers are few. We have to make sure we have regional centers. We also have private centers that have really helped. Aga Khan, Gertrude's Hospital, they are also part of the centers that have done a lot of work to support our children, and we appreciate everybody. Now, we would want, as a country, we are at a work of UHC, Brian, and NARA. Currently, the leadership, the Kenya Kwanza government, bottom-up economic
approach
transformation agenda has health as their major pillar. And from a policy perspective, we have we want to improve on health systems because you cannot treat cancer in isolation. You have to improve on health systems generally, making sure we have the right infrastructure, we have the right technology, we have the right commodities, and these are speaking to each other. We should also develop national cancer control plans. We currently have a national cancer control strategy, that we are implementing. It's a 5-year plan. We are into its first year. And childhood cancers are largely, in this plan. If you don't have a roadmap, then you would not know where you are heading. So for us to eliminate childhood cancers, we have a plan. And right now, we have a global initiative on childhood cancers, which is captured in our plan. But that by 2030, we should have cured, improved cure of our children who are diagnosed with cancer by 60%. So that that is how we are closing the gap. That's how we are reducing it. Now, developed countries are at 80% survival. We would also want to get there. We are at 20. So we would want to make sure we reduce this survival gap. We also have to make sure we implement, cancer workforce training. The only way we can address challenges that we have is through training, education, community health promoters. We are training them. We are training those who are also in mainstream curriculum-based programs, in our medical school, nursing schools, in our laboratories, in our radiology centers. And right now, we're even doing advanced training of pediatricians, those doctors who are already qualified to take care of children. Further training, advanced training called fellowships in pediatric hemato-oncology. University of Nairobi is providing that. More University is providing that. And we are encouraging a lot of training on the same. The other thing that is very important that we are also looking at is advocacy. We have to advocate. We are looking at establishing cancer registries for children. And cancer registries...
Specifically for children.
For children. We're not going to use the adults one. And, data is very important. We will use it for national planning. We will also use it for research so that we can answer our questions. The other thing that is important that we are looking at is strengthening referral pathways. You had asked me that question.
Yes.
It is in part of our policy documents because proper referrals, very important. We have appreciated that many patients present themselves to our hospitals, but because of bureaucracies, delays, untimely referrals, patients get their disease progress. Because the challenge that we are facing right now, even in adults, is late presentation. And sometimes it's the system delays that we have these challenges. So we are working on making sure that availability of essential medicines to treat children. WHO is asking, very soon, we hope we can be one of the countries that are going to receive essential medicines for children.
We will.
And
we must.
Finally, using guidelines and protocols in treating our children so that we standardize care. Whether you are in Nairobi, whether you are in Mombasa, whether you are in Garissa or Busia, there has to be standards and there have to be guidelines and protocols that we are using. We also want to make sure there are treatment packages. You've heard about SHA, our new health, care financing, social health authority. NHIV is gone.
Yeah,
are you aware? It's
I'm
dead.
aware.
It's gone. It's repealed. So right now we are in the wake of social health authority, and here there are packages that we are using to make sure comprehensively anyone diagnosed with cancer, not only children, are able to comprehensively be covered. Because cost has also been a challenge. It's very expensive to treat cancer.
Yes.
You've had people going outside the country. Do you know something called bone marrow transplant, Brian?
Heard of it? Heard of it, yes.
We are actually destroying all the cells in your bone marrow when there is an indication, and infuse new cells that are going to multiply. And by destroying the entire bone marrow, we'll have destroyed where cells multiply that becomes cancer, and we infuse new cells that are going to multiply. Right now, Nairobi West Hospital is able to do bone marrow transplants, and Kenyatta National Hospital might be the first public hospital to do the same.
Yeah.
So, and packages are going to cover that. And
yes. On that note, because of time.
But next time, give me enough time.
Brian. Yeah. Next time we're going to give you enough time.
These are serious matters that we really have to.
It doesn't end today, Daktari.
So
it doesn't end today, Daktari.
Next time,
enough time.
You give us enough time. And not only me.
Yeah.
We have so many experts,
yes.
so many specialists across the country that will come here and educate these young people who are listening, and also, the older ones who are fans of Young
Nation
People
FM,
program, right? Thank you very much, Brian, for having me here. I think it's been fun.
Daktari, it's been amazing having you. Here we have something called Makofi Ka Olomide, just to say thank you for giving us a chance to have a front seat on the cancer situation in children, and especially in the children of Kenya. You've talked about 3,200 new infections yearly, and it was quite peculiar and quite sad to get to experience that. But thank you so much for the insight.